Dr. Lee, and I'm going to talk to you today about... Hello?
Hello, is this Dr. Lee?
Yes, this is.
Well, I'm having some issues with my baby. She is 3 to 6 months old, and I feel like she can't hear me or see me. She's getting thinner by the moment, and she's very weak right now. She did have a couple of seizures. I'm not sure what's going on.
I think this may be the cause of the Tay-Sachs disease. Have your child come to the hospital immediately, right away.
Yes, ma'am.
Okay, instead of proteins today, I will talk about the Tay-Sachs disease. Tay-Sachs disease occurs when the body lacks a protein that helps break down a chemical found in the nerve tissue called gangliosides. Without this gangliosides protein, it's particularly ganglioside GM2, build up in cells, especially nerve cells in the brain. Tay-Sachs disease is caused by the defected gene on chromosome 15. When both parents carry the defected Tay-Sachs gene, a child has 25% chance of developing the disease. The child must receive 2 copies of the defected gene on one from each parent in order to become sick. If only one parent passes the defected gene to the child is called a carrier. He or she won't be sick, but will have the potential pass of the disease to his or her own children. Anybody could be the carrier of the Tay-Sachs, but the disease is most common among the Ashkenazi Jewish population. About 1 in every 27 members of the Jewish population carries the Tay-Sachs gene. Tay-Sachs has been diagnosed to mainly little children. The disease gets worse very quickly, and the child usually dies by the age of 4 or 5 years. But it is very rare for adults to be diagnosed with the Tay-Sachs disease. The symptoms of the Tay-Sachs disease is deafness, decreased eye contact, which blindness is what it means, decreased muscle tone, delayed mental or social skills, dementia, increased startled reaction, irritability, dizziness, loss of motor skills, or loss of muscle function, seizures, and slow growth. The signs and tests for these Tay-Sachs disease is suspected. Me, the doctor, will perform a physical examination and take a family history. Additional tests may be included, like enzyme analysis of blood or body tissue, or eye examinations, if revealing a cherry red spot in the macula. There is no treatment for the Tay-Sachs disease itself, but only ways to make the patient more comfortable. There are also support groups that you can join to if you are diagnosed with the Tay-Sachs disease. If your child is diagnosed with the Tay-Sachs disease, be prepared that your child's symptoms of the disease will just get worse over time and usually die by the age of 4 or 5. The complications of these symptoms appear during the first 3 to 10 months of life and progress to spasticity, seizures, and loss of voluntary movements. If your child does have Tay-Sachs or the symptoms of it, you should call your local emergency number if your child has a seizure of unknown cause. If the seizure is different from previous seizures, if the child has difficulty breathing, or if the seizure lasts longer than 2 to 3 minutes, call for an appointment with your healthcare provider if that does happen. There are no ways to prevent this disorder, and genetic testing can detect if you are a carrier of the gene for this disorder, or if your partner or the at-risk population. It is recommended that you undergo testing before starting a family. Testing the amniotic fluid can diagnose Tay-Sachs disease in the womb. And so, yes?
Your patient is here with her baby.
Okay, thank you. Bring them right away. Okay, well, time's up. So I hope you learned all of the information about Thai sex disease, and have a good day. Bye!